want to thank everyone for tuning in. We've got a few technical difficulties, but we'll get through it. Again, I want to thank everyone for coming in, stopping by. I've had some folks say they are hearing and seeing me, and I want to thank them. I want to thank all you folks for doing that. Again, this is a movement. It is it's a transition, and um, in retrospect, we're going full circle, and I want to thank my co-host, Miss Barbara Howard. She is out uh, again doing some family and just being productive. She's very busy with Nabi, and we just want to say hello to Gigi Crowder. And all we do disagree about Hub versus Healthcare Center. I want to thank her for all her work. Um, I I'm feeling real thankful today, so I'm really excited. I met with my board. I am president of a nonprofit, Byron Rutherford Housing Association. Have a resident board. I'll say the names: Miss Ash, Miss Cher, and Richard. Really good folks to work with as we try to deal with this housing issue in a small way. Try to maintain affordable housing, which is again the issue around food, clothing, and shelter. And I just kind of excited, getting ready to launch a website, and I want to thank Edie uh, Akamoto for her work on this, and all the folks that made education the best medicine possible. This is the Medicine Hour. And I want to make sure you stay tuned into us. This is the second Saturday of the month, and it's the Medicine Hour with me from 2 to 3. We started a little late. And my co-host, Sister B. Mello, Miss Barbara Howard, is on sabbatical and will be returning soon. And the focus of my show and of this show is this is where we believe building a better tomorrow starts with us. Um, we're going to cover topics today, health topics to include healthy eating, education, financing, and politics in the African American communities. Again, um, I think it's important that we focus on the African American community, and that will always be my focus. I will welcome and have an understanding and try to be supportive of all of the communities, but a focus that I think is not, I'm unabashed in saying, is about African Americans, particularly ones that are descendant of the African slave trade in America, and of the representing the current California reparations paper. And I think it's something we'll always talk about because I think that's why our health concerns are such as they are. The third Saturday of the month from 2 to 3 o'clock, which is next week, is Education is the Best Medicine. And I'm the host, and I have a 501c nonprofit, and I've been doing basically community-based issues, health, access, education, um, discussion around food, clothing, shelter, housing, and how it impacts our health, healthcare advocacy, and understanding how our healthcare or lack of it affects our lives and the quality and the length of our lives. Um, the fourth Saturday is the kitchen table, and there's going to be a readjustment in that. Ms. Harvey's going to change the focus of the kitchen table, and I'm really looking excited to the new focus. We want to really bring in more young folk, and that's exactly what she's going to do. Um, and I'll be hosting with her at that show on the fourth Saturday of the month. And again, this is Believe Radio with the 24-hour inspirational gospel music station. We are a multi faceted level station and expanding and look forward to your support and continue to listen to us. So that being said, um, I wanted to talk about not only influenza but history. Um, and again, the show is dedicated to my dad and my stepdad and my great great grandchild, uh, Khalid. Uh, and so the focus of the show is influenza, but more so that for me, it's a historical piece too. Uh, in 2000, from 2003 to 2008, I was afforded the uh, ability and the given um, a, an ability to write. I did a monthly article in a paper called Mina. The publisher was Anthony Rabb, and MENA stands for Minority Education Employment News. And so I had a column there. And Miss Howard also had a poem column. And in fact, she introduced me to Mr. Rabb, who subsequently asked me to start writing the paper. And um, in November of 2005, Miss Howard did a inspirational poem called "Rooted from God," and hopefully she'll get a chance to share that. And at that time, um, in I had been writing in 2003. I did an article called "Compliance and Adherence Are the Issues with Immunizations in Our Community," and as the title implied, we've always been mistrustful of vaccinations, immunizations, shots, hospitals, medical care, medicines. And we have a very good reason for that. The healthcare system uh, uh, has been very oppressive to our health. The public health system in some parts of the country have not been able to provide basic things like clean water. So therefore, you have a number of communities, particularly African American. Again, African American. Although I know you say black, it's African American. Those are the descendants of African slaves in America and descendants of the slave trade. Those who have been mostly impacted by this because the uh, effect of these issues has been long term. I can't even imagine uh, a higher infant mortality rate if you don't have clean water or if the water has lead in it or you don't have access to formula. So this is where it got me to think about influenza. And it is influenza season, and yeah, COVID has not went anywhere. And so I want to make sure we kind of understood that this is an ongoing cycle. I know we have COVID fatigue, and um, we're tired of hearing about it. We're tired about the lockdowns. We're tired of the lost times, the restrictions. We're tired about going back to work. We're tired about being re-exposed. But in reality, um, we have to now do workarounds this virus because it's not going anywhere, COVID or influenza. And the reason why I bring this up is that last year, and when I was a couple of years ago, when I was working in the middle of this, excuse me, COVID pandemic. Pandemic meaning that it happened so quick and so fast and it spread so quickly that it overwhelmed us. That's a pandemic. And in kind of reading, preparing for this, I kind of want to uh, have a discussion about where we've been as opposed to uh, where we're at and where we're going. Couple of things, and again, this kind of bases itself on the article that I wrote about influenza and the MENA article of 2005. In fact, I have it here, and I was I was kind of uh, discussion around. I said that the influenza virus. Uh, Again, we were talking about. I wrote this in 2005. Uh, it says I said that the influenza. There are two. Excuse me. The influenza virus is composed of small particles of genetic material called DNA. There are two types of this contagious respiratory virus: the A and the B. The influenza characterized by two patterns: an annual epidemics, but in rare but devastating pandemics that occur about every 10 to 30 years. Again, pandemics are epidemics of a disease that affect not just one country, they affect the entire world. And I guess my point about saying that is that the influenza virus, as well as the COVID virus, and because we've got to talk about them in parallel, um, are respiratory and global. And so, as I always tell folks, look at China, then you'll see how the effect of non-vaccination and lockdowns affect the country's society and its well-being and its economic well-being. There were some choices made about to quote unquote live with the COVID virus, and I think that I still and I will continue to trumpet this that we have not vaccinated the youngest in our communities from 5 months to 4 years. We still haven't vaccinated them. And so they are still at risk for COVID. They're still at risk for flu. So again, I think the designation for vaccinating children has changed. But again, COVID vaccine is still in that gray area. So we need to the big and what my take home from a lot of the readings I did was that the vaccinations, although not perfect, are our best deterrent to global pandemics. And as you can see, as a large population of Americans got vaccinated COVID, the incident of hospitalizations and deaths, although still occurring, went dramatically down. And again, this is in the season, so you have to kind of pat President Trump on the back. You have to pat President Biden on the back for getting this done. So, and I said that I said reflecting on COVID vaccine hesitation, we're approaching another winter season, and we could be lulled to sleep by uh, because of this COVID lockdown, fatigue, restrictions, loss of losing your mind, basically, in the psychological issues that go on with this particular issue. And again, we still haven't vaccinated those 6 months to 5 year kids. That's why I wear the mask for. That's why I'm going to get my fifth vaccination when they become available. Because I think it's important that we continue to protect ourselves because this is not going anywhere. Um, and I think to look at this in retrospect, you have to look at the influenza pandemic of 1918, and this is from a Stanford University article. Um, it's the influenza pandemic of 1918 to 1919 killed more than the Great War known. We know this day is World War One, and somewhere between 20 and 40 million people. It was had been cited that the most devastating epidemic in recorded world history. More people died of influenza in the senior year than in 4 years of the Black Death bubonic plague from 1347 to 1351, known as the Spanish flu. The influenza of 1918 to 1919 was a global disaster. So just imagine 20 to 40 million people dying, and no treatment, no aspect for treatment. They didn't know what it was. They just knew it was killing a lot of people. They lied about it from some of the literature that I understood. So this whole idea of don't trust the government goes deep. Um, and I think that the different types of influenza of the flu virus. The avian influenza flu, the bird flu. This is just a disease that's caused mostly and transferred by birds to other birds, but it had the effect of affecting the domestic poultry population and other bird animal species, and then so therefore they jump to humans. In fact, I just reviewed an article today about the influenza virus jumping from a pig to a human. So again, these are the global situations that happen. The N1, H1N1, and that's familiar because that's the same virus that affects humans, but it's a respiratory and it's human to human transference. And again, a relatively new strain uh, causes symptoms similar to the regular flu. It originated in pigs but spread primarily from person to person. Again, I would like to emphasize that both the COVID virus and the influenza virus are respiratory viruses. They are transmitted majority of the time by human to human contact. That's why over the last year you saw decreased transfers because of masking, social distancing, hand washing, and then the onset of the vaccinations. So that's the treatment. So remember, I always tell you I give you a treatment, right? Yeah, I just gave it to you. Uh, and Swine flu made it headlines in 2009, and it was first discovered in humans and became a pandemic. So again, this word pandemic, something that starts relatively surprisingly and then spreads to the population. And as again, in preparing for this talk, one of the issues with the flu vaccine was it caused a neurological condition called Guillain-Barré. Um, President Ford may have lost his presidency behind it because, again, misinformation, miseducation. These things are all new. There's nothing perfect, and I think that that's what we have to kind of understand that this is a moving target. COVID, uh, uh, influenza, monkeypox are all moving targets. They have human vectors, so they cross the country, cross the world quickly. The original exposure to uh, uh, was in Spain in terms of monkeypox, and it was after they were having some sort of gala event, and that's because of the skin-to-skin contact, not necessarily because of sexual contact. It was just skin-to-skin contact, people partying, having a good time, I guess. But again, um, kind of understand that this is a majority of these things happen from human vectors, human transmission. Again, last year, in the last couple of years, from the hand washing, and masking and vaccination, influenza was totally non-existent. But we'll talk about some of those numbers. Um, and In terms of the H1N1, the World Health Organization uh, deemed it a pandemic in August of 2010. And look at the time frame. We're in 2010 now, and we're almost into 2022 in the present. So that's just 10 years back. So all these things are evolving. All these things, viruses are changing, and in reality, the reason why they're changing is because that is the survival mechanism for viruses. They have to mutate in order to change, in order to survive, like anything else. And so whatever vector they can find, whatever host they can find to continue to replicate, they do. I think that's what I kind of understood about HIV, in that the HIV virus, the virus would go inside of the cell and change the machinery of the cell so that it would create more HIV virus. I thought it was absolutely amazing. That and this is survival, right? And until they develop three-tier drugs that uh, address the replication of the HIV virus, and the virus will continue to grow, and now it's now a chronic disease. Again, science, medicine, amazing. Um, so I think that we're now talking about a ongoing and oncoming flu um, epidemic, and because we've taken our guard down, um, and they did some preliminary estimates for the 2021 to 2022 flu season, uh, and again, these were like estimates. Again, in a lot of this data, my personal bias is that it's underreported. In fact, I don't really think we have a real good gauge now of who is positive for COVID, who is not, because of home testing and the lack of reporting now, because we've stopped reporting. So anytime you start reporting, the only time you get data is if you go to the hospital or go to your primary provider. And that has to be reported. And so there's always a lag time in terms of the numbers of people that are being reported, as well as identifying, well as confirmation. So I think that you have to take that into account as you listen to these numbers. Um, so they said from October, this is the CDC website, put in CDC influenza, go look up some of this information. Education is the best medicine. Please educate yourself, uh, and understand that as we talk about this being the medicine hour, we understand that it's more than medicine that allows one to live a happy and productive life. And if you talk to the folks from the Armada Project, um, it's a lot more than the absence of disease. So, uh, the CDC estimates that on October 1st, 2021 through 20, uh, the CDC estimates that from October 1st, 2021 through June 11th, 2022, there have been about 8 million to 13 million flu illnesses. And it's equated to 3.7 to 6.1 million medical visits. And there's been 82,000 to 170,000 hospitalizations, somewhere between 5,000 to 14,000 deaths. And it says it here, it says, because the influenza surveillance does not capture all cases of flu that occur in the U.S., CDC provides these estimate range to better reflect that the larger burden of influenza. These estimates are calculated based on data collected through the CDC's influenza hospitalization service. Again, if they're not coming to the hospital, then you probably we are underreporting. Um, and again, the types are type A and type B, and they're further uh, have a subcategory. They also have a hepatitis. Obviously, they have a influenza C. Um, and one of the things I thought was kind of interesting, and I just want to keep emphasize this, as because it will reflect COVID also, says that influenza viruses undergo constant genetic change, which are substantially impacted or induced immunity and consider a variation for vaccines. So in other words, the folks that make the vaccines have to anticipate that the virus will change and try to anticipate that change. Uh, I was listening to a talk, and hopefully this has changed, but there were only 4 vaccine makers at the time. I was listening to this talk about a talk from one of these Stanford immunologists about 10 years ago, and 2 of the vaccine makers don't aren't even in the country. The supply chain and the chain for public health continuity and fluidity to get the vaccine from government to public health is still really, really hard pressed. You can see it now with monkeypox, and that's because this has not been an investment in the infrastructure. The discussion that it was enough to do. So I guess my political take on it, if you can spend as much money providing weapons of war, you can definitely provide weapons of peace and health. Just my thought. Um, and so this kind of variation is called a antigenic drift, and so when an antigenic drift is basically the virus mutating such that it survives, basically, um, and one of the things that we have to stay ahead of is that constant mutation. COVID is constantly mutating. And so the preparation has to be such that um, we're able to anticipate those um, variations. Um, and and this, so I guess some of the things about circulation and traveling, again, dealing with these ongoing pandemics. And understand, I think there's that now we have less hospital medical frontline personnel to handle the next pandemic. Uh, they have not been trained fast enough. We have a lot of deficits in key physicians' laboratory, you know, uh, frontline staff. Um, you can only do so much. So it's going to be encompassed on society to keep itself healthy and to ask for and anticipate systems change. One of my degrees is in organization behavior, and the discussion on organization behavior is that it implies that the system is forever changing. If you don't change, you'll be changed by the change. Um, so the common thought, and we're approaching it, influenza viruses typically circulate most commonly, again, from uh, the east to the west, from late fall to early spring, and most people become ill and after the virus infection. Um, it is devastating. It can you can cause serious illness, hospitalization, and death, particularly among older folk, myself, and younger folks, pregnant folks, persons of all ages with certain chronic conditions. This is the risk group that is most impacted by lack of vaccination and exposure to the influenza virus as well as the COVID virus. Um, Now, that's why I say we're lulled into a sense of we're just lulled into a sense of being too secure about what's going on. I said influenza has been historically at low levels globally during 2021. So we haven't had that much um, influenza because of hand washing, social distancing, masking, suspension of work, suspension of travel, commuting, all those things. And still, our largest concern, and my largest concern, are our babies from uh, 6 months to 5 years. Those are the ones that are not being vaccinated, and I'll keep saying that. So, common flu symptoms: fever, feeling feverish, child, and again, please uh, consult your health provider for changes, how you're feeling. Contact them through telephone or through email. Just don't believe that you're going to get better. I find that a lot in my older populations and a lot in my younger populations. Younger populations think they're invincible. Older populations don't want to hear bad news. Like in The Wizard of Oz. Don't bring me any bad news. I can't. Um, so fever, feeling feverish chills, cough, uh, sore throat, uh, runny stuffy nose, muscle body aches, headaches, fatigue, some vomiting in some folks, some diarrhea. And interesting enough, you don't have to have a fever in order to have the flu. Uh, the risk populations are adults age 65 and older, children younger than 2. Uh, and these are the folks that are going to likely suffer complications if they are exposed to the flu and get sick. Blood disorders such as sickle cell, COPD, chronic pulmonary disease, lung disease, endocrine disorders such as diabetes, heart disease. Let's just say everybody, right? Coronary artery disease, just heart failure, kidney disorders, liver disorders, kidney failure, hepatitis B, C, uh, diabetes. Uh, again, people who are obese, body mass greater than 40, total body mass, it should be something around 26, 25. People who are obese, people younger than 19 years old with long-term asthma or on aspirin-containing medications. People with weakened immune systems such as HIV or AIDS, cancers, leukemia. Um, Again, other people who are high risk for the flu, and I thought this was kind of interesting. That's why I included pregnant people and people up to 2 weeks after the end of pregnancy. Uh, Again, are we really managing, since we have such a high infant mortality rate and a high poor outcome of moms post pregnancy? I mean, are we really doing that kind of work just to make sure that the prenatal visits and follow prenatal visits, folks are getting their preventive vaccines? People of certain racial and ethnic minority groups increased risk to hospitalization with flu, including non-Hispanic, Black persons, African Americans, post uh, Reconstruction of the Middle Passage, Hispanic, Latino, American Indian, Native American, although children younger than 5 were considered at higher risk of serious flu complications. The highest risk for those younger than 2 with the highest hospitalization and death rates are infants younger than 6 months. We cannot afford not to get vaccinated because our babies still are going to really feel the brunt of this. Um, because think about it, going back to school, going back to work, unvaccinated, and again, the infrastructure of a lot of our schools fails, doesn't have air conditioning, doesn't have central heating. Again, mold, mildew, those kinds of things in a lot of these schools, and just the mere fact that we're in a culture now that just wants to tell us to get an education, but then close the schools that's next to me. I just don't get it. Um, the the other thing is, the good thing about it is flu can be treated, and they have a host of treatments, and these drugs are called antivirals. And I can't do a commercial for them to go take a look at them, discuss them with your provider, and they are they are drugs prescribed, and it can be in a pill form or liquid form, or in some cases inhaled, or in some cases intravenous solutions. They help the body fight the flu virus. Uh, Again, these are not sold over the counter. They're prescribed by your healthcare provider, and they're different from antibiotics. Um, they they only fight which fight bacterial infections. Antivirals only work on the flu and flu-like viruses. flu antiviral drugs are different than antiviral drugs used to treat other infectious diseases. COVID antiviral drugs prescribed to treat COVID do not work to treat flu. That's why it's a different issue. So you have to specifically be prescribed for antivirals for flu versus antivirals for COVID. And we'll talk about a little bit of the differences because there aren't that much of a difference. You really can't tell if a person has COVID or influenza type A, type B, HN1 unless you test them. And so, and again, um, just you got to get treated. Uh, so some of the things. So what if you get sick with the flu? The antivirals are a treatment option. You need to check with your provider, and because we don't want you to have any uh, issues in terms of complications. Uh, Flu signs again are feeling feverish, fever, cough, sore throat, runny nose, body aches, um, and fatigue. And the thing I think about flu is that it just makes you feel terrible. I mean, it's just overall the acuteness of the illness and the way it makes you feel. It gets your attention. As Dr. Fauci says, you know you're sick. Uh, uh, and But to prevent all that, you need to get the vaccine. The flu vaccine works two ways. It prevents the seasonal flu and it potentially prevents severe complications. And everyone 6 months and older should receive a full vaccine every year unless you have allergic to eggs or, again, may not be a person to take. You have to check with your provider. Um, and The benefits of the antiviral drugs are treatment works best when started soon after the flu illness begins. When treatment is started within 2 days of becoming sick with the flu, and again, I've had to go round and round with uh, patients when I was practicing and about coming in 5 days and down with flu symptoms and still want the pills. I was like, it's going to be effective when you expose yourself to that. Hey, okay. But again, it's most effective when given in 2 days, and it'll lessen the fever and shorten the course of the illness. Um, and Again, reducing complications in children, ear infections and respiratory complications. Again, our elderly, our children have the most to fear from a unchecked flu exposure that has them really, really sick. Um, uh, and, and again, for people at high risk of serious flu complications, early treatment with antiviral can mean mild illness, as well as decrease in severe illness. Again, preventing hospitalizations, preventing death and disability. Loss of time from work, all this kind of thing. Um, there are about five antivirals approved by the FDA, and recommend you get with your doctor and talk to them about them. Tamiflu, Rosaline, and Rapavant. Um, Commonly prescribed. Again, these are prescription medicines that you have to speak with your provider about. So you'll be speaking to your provider one way or another. Okay. And uh, In terms of the course of treatment, somewhere between 5 days and or one dose, depending if it's or just one day. So there are a number of options for people, and I guess some of the side effects folks are most concerned about nausea and vomiting, some chest tightness, a little bit of diarrhea, and commonly reported. But again, when you think about the global effect, I want folks to kind of think of the, you know, always say that an ounce of prevention is worth a pound of cure. I don't know if Ben Franklin said that, but I know that I want to limit the exposure uh, of illness from death or disability, and if I can do that, then I'm really going a far way to benefiting someone uh, going in the road to recovery. Um, uh, and from the literature standpoint, yes, children can take antivirals. Again, you have to talk to your pediatrician. And again, these are things that you need to speak with your provider about. But there are options. You don't want anyone to suffer, stay sicker longer than they should be, or risk complications such as pneumonia because they weren't treated early enough. Pregnant women, especially, need to be treated. They risk of, of baby injury as well as loss, as well as their death. Uh, it's simple as getting vaccination. Let's do that. We need to avoid serious complications. Um, and so, one of the questions and my final, I had 15 minutes. Wow, thank you very much for listening. Um, I really enjoy these topics. I really enjoy the, the discussions that I've had over the number of years. I know I'm changing when, and I'll date myself. I used to work with a psychiatrist practice, Schumann Lyles, and understanding now that both of them are retired. I think Dr. Lyles may have passed, Dr. Schumann may have passed, but Dr. Lyles is retired. We wish him the best in his life of retirement and enjoying all the things that he's been able to accomplish in Oakland as a psychiatrist working in the community. They gave me one of my first chances to work in mental health, and I'm forever grateful for that. Um, yeah. And, so there did so let's do some comparisons about influenza, flu, and COVID-19. Influenza and COVID are both contagious respiratory illnesses, but they're caused by different viruses. COVID is caused by with a coronavirus, first identified in 2019, and the flu was is caused by a flu virus, the influenza virus. And I think the distinction made is that we've been studying influenza longer than we've been studying COVID. So just on the mere sense of it is that influenza is a longer disease entity from a viral nature in our community, and we're just starting to understand the study of COVID-19. And we know that COVID, we're learning that it spreads more easily easier than the flu. Thereby, uh, from the east to the west, that's how we get the virus coming here so quickly. Uh, uh, and uh, um, and so and that's why we all need to be vaccinated again. Uh, Compared to the flu, COVID can cause more serious illness in some people. COVID also can take longer in people to show symptoms. And people remain contagious a longer time with COVID. Again, masking, hand washing, vaccination, and we're just starting to understand these things. You cannot tell the difference between flu and COVID just by looking at the symptoms alone because they have basically the same symptoms, as I said. That's why testing is important to distinguish between COVID-19 and influenza. Um, uh, and For both COVID-19 and flu, one or more days can pass when a person becomes affected when they start to experience symptoms or illness. And the difference is that a person has COVID, it could take longer to experience symptoms uh, than is the flu. Like I always say, the flu is dramatic. It just bam, and you're there and you're sick and you're not feeling good. Man, and so for the flu, typically a person maybe experience symptoms anywhere between 1 to 4 days after infection. And COVID, typically a person may experience symptoms anywhere between 2 and 14 days after infection. So shorter course but more dramatic, longer course but more subtle, and over a longer period of time. That's why the issue with quarantining, because the virus for COVID was still continuing to replicate. Um, how long? Um, and these are all questions asked from the CDC, and CDC on influenza is a great site, great informational site, pretty easy to navigate. Uh, so how long can someone spread the virus? Both COVID-19 and flu is possible to spread for at least 1 day before experiencing symptoms. Different if a person has COVID-19, they could be contagious for a longer time if they have flu. For a long time if they had the flu. Most people with flu are contagious for about 1 day before they show symptoms. Older children and adults with flu appear to be most contagious during the first 3 to 4 days of the illness, but many people remain contagious for more than 7 days. Infants and people with weakened immune systems can be contagious for even longer, and they suffer. So that's why we don't want our babies to have that. Okay, this is about the babies, ain't about you. Uh, and Again, on average, people spreading the virus 2 to 3 days before their symptoms begin, uh, uh, but infectious peaks 1 day before the symptoms begin. On average, people can continue to spread the virus another 8 days in terms of COVID. Again, the non-dramatic nature of COVID versus the dramatic nature of influenza. Shorter infection time, a long exposure time for COVID than for influenza. Uh, and again, both can be spread from person to person between people who are in close contact with each other. Within 6 feet, people are spread and they spread mainly by small particles containing the virus that are expelled when people with the illness, COVID, or flu cough, sneeze, or talk. These particles land in the mouths and noses of people who are nearby and possibly inhale to the lungs. Some circumstances, as in indoor settings with people, poor ventilation, small particles may be spread further than 6 feet and causes infections. This is why I'm concerned about school. Why I'm concerned about the upcoming and the lack of vaccinations in our younger population. And overall, we really had a real break in the pediatric vaccination schedules, and those need to be reamped up. And I just implore parents to get their kids vaccinated before they return to school, or they're going to get sick, and you're not going to be happy. I can see it now. Um, and you're going to want these antivirals put into your child? No, not really. But you're going to have to because the kids get sick. They get too sick. You don't want them. You don't want them to suffer. So easier to get vaccinated. Uh, and again, most of these viruses, both of them are spread by inhalation. Again, the human being is the vehicle. It's the vector, in these viral entities. Um, Not transistors, not, don't use bleach, you know, man. Just stick toward the science, stick toward the evidence. I'll always try to provide that kind of information. I don't believe in experimentation. That's only in the movies. And if you're reading Frankenstein, Frankenstein was written by a woman. That's interesting. Um, so, again, just to kind of be clear, our highest risk group are older adults, people with underlying medical conditions, uh, pregnant women, pregnant females, uh, and overall, COVID-19 seems to be more serious than some people. Serious COVID illness results in hospitalization and death can occur even in healthy people. So that's the concern. And we saw it during the pandemic where seemingly very healthy people went to the hospital and didn't come out. Were able to be exposed to family members and some of the complications as we close this out. Pneumonia, respiratory failure, uh, 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 respiratory distress, sepsis, infection, cardiac injury, multiple organ failure, worsening chronic medical conditions. Again, easier to get vaccinated. We have approved treatments. But if you get sick, you can get treatment. But if you get vaccinated, and again, speaking for a lot of the older men and women that need the pneumonia vaccine and the shingles vaccine, let's get these things done. You know, um, I think um, I finally want to close by saying that in my article, it says continue ongoing debate with others, heighten awareness, and increase immunization of risk groups. We will have to do. I suggest getting vaccinated and avoid exposure, hand washing, covering your mouth when coughing. This should not be the case of too little, too late. Access treatments and prevention are vital to preventing a tragic recurrence. Thank you very much. I want to thank all you folks for listening. And I want to say thank you again, and we'll all talk next week. And again, thanks for listening. Bye bye.